Viruses and vaccines. The fall respiratory virus season is once again upon us, and many people are wondering how to keep themselves and their families healthy over the next several months. Dr. Rosha McCoy is a pediatrician and the Senior Director for Advancing Clinical Leadership and Quality at the Association of American Medical Colleges. Thank you so much for joining us this morning, Dr. McCoy. Let's jump right into it. So what can you tell us about these new recommendations for the COVID vaccine? Who should get them?
Sure. Anybody who's older than 6 months should get an updated vaccine. So that's the bottom line right now. The new updated vaccines are available for COVID-19. I think most of us know somebody who's gotten sick recently with COVID-19, if not ourselves. So that means many people's immunity is waning. And so it's really important that anybody over 6 months get an updated COVID-19 vaccine.
And when would you recommend for people to get the shots? Because, of course, we've been reporting that cases here in our state as well as across the country have been going up. Should we wait to maybe around maybe Halloween or Thanksgiving? Is there a certain time, or when do you think we should get them?
Yeah, there's really no reason to wait. Just like you just said, we all know that cases are going up, so there's no reason to wait. I think the key will be how soon supplies will be available widely. Obviously, the vaccine was just approved last week, so it's getting to pharmacies and primary care physician offices. So I think it's really important to call your doctor, see if they have the shot available yet. But as soon as it's available, people should get it.
And of course, we are talking about the COVID vaccine. Of course, around this time of year, we also talk about the flu shot. Do you recommend people getting the COVID shot and the flu shot on the same day, just different arms, or should they wait and schedule one different? Oh, so you say yes, they should. Tell us why.
Well, it's just there's no reason not to, and everybody has busy lives. So sometimes if you put things off, then you're not going to get one of them. So we really recommend using every opportunity to go ahead and vaccinate. So yes, you should get both at the same time. If people want to wait, certainly go ahead and get the COVID vaccine. We recommend getting the flu vaccine in September or October. Again, really important to get the flu vaccine before flu cases really start ramping up. So those are our recommendations.
And of course, as always, even one thing we did learn about going through the pandemic was there are skeptics out there. What would you say to those skeptics who say that, by now we've built up immunity, I'm not going to get a COVID shot, I'm not going to get the flu shot? What do you say to those people?
Well, I think it's important that people consider that we use everything that's available to us. I think people really need to remember back when this pandemic first started and how scared we all were because there were so many people dying from COVID-19. We still don't know who really, we know that people with immunocompromising conditions and older folks are more at risk from COVID, but, young healthy people can get sick with COVID as well. And we also know that there is something called long-haul COVID, where there are lingering long-term symptoms from the COVID infection. So, and the vaccine has really been shown to help decrease that. So we have a safe and effective vaccine. So we highly recommend that everybody get the updated vaccine. These vaccines are getting updated for the variant that is most common in this country right now, and really use what we have at our disposal.
And my last question that I have for you, because a question that comes up every single year around flu season, some people say that they don't want to get the flu shot simply because they say that the flu shot will give them the flu. What do you say about that, Dr. McCoy?
Yeah, there's no evidence that the flu shot gives you the flu. It's not a live virus vaccine. You can't get the flu from the flu shot. Certainly you could have a sore arm, etc. But if there are a lot of viruses out there, so if somebody gets sick after getting the flu shot, it may be that they have a different virus. The other thing is that flu shot doesn't totally prevent you from getting the flu. It makes it a less serious illness. So there is no evidence that you can get the flu from getting the flu.